Right. I was always taught if someone had back pain to stretch the hamstrings, do a lot of soft tissue work on the hamstrings. I don't really do that anymore. If someone does have tight hamstrings and they've got back pain and they've got a core that's not as strong or as well functioning as it could be, very often they'll go into a high threshold strategy. And all a high threshold strategy is are the muscles that you use for running and jumping. Your hamstrings, the front of your thighs, your rectus femoris, even muscles up here in the neck and the shoulders. They take over the job of the soft core. Okay? So they become stabilizers. These big muscles, the hamstrings are not stabilizers, they are movers. Look at athletes, they've got huge hamstrings, huge butts. Okay? So it's a good idea, if someone does have tightness, look at their soft core. So if they've got rotations, they can't control their lower back, they've probably got a core issue. As soon as you strengthen the core, improve their motor control, very often they go out of a high threshold strategy. The hamstrings, which attach from the lower leg onto the pelvis, the rec fem, which attaches from the pelvis onto the tibia, they all can stabilize the pelvis. So if you can improve the soft core, these muscles all of a sudden can release. And you don't have to do any aggressive stretching or therapy work. Okay, so what I'd like to do now, we've already identified rotations, okay, with the leg falling out, right? I'd like to show you an exercise which comes from Stuart McGill. It's called the bird dog. And it just teaches people, without too much talking, how to stabilize their lumbar spine. So, Renata, could you go onto your hands and knees, please? Okay. So these are opposite diagonal movements. Can you point that arm straight in front of you? Keep it there. And point that leg behind you. Okay, now I'm just going to show with my hand what I would like. There. That's a neutral pelvis. Can you bring your elbow and your knee back together and go out again? And you don't even have to touch, Renata. Come back, that's enough, and go out. I'm going to take my hand away, and I want you to keep your back neutral. Right, come back and go out. Good, I'll push that. Go in. Harder than it looks, truly. Very good. Right, other side. So arm out, leg out. And you can even, if you want to make it fun, or make it so they get some feedback, you can put a cup of water or a roll on the back so that they're aware if it falls off, they've lost control. Right, come back and go out. She's better on this side. So this exercise, I would do half on this side, and then we go back to the other side. This is where Renata's got a rotation. Look how the pelvis comes up. Down, there. Right, in you go. And out. This is the side I would work on. Beautiful. And relax. And this has got nothing to do with strength, okay? And it's got nothing to do with sweating and battling. You get your client to do as many as they can do well, and then stop. Let the brain learn good movement patterns. And again, the beauty of this, whatever needs to strengthen and become more coordinated, it will. All you need to do is say, keep your back straight. No more cueing. The brain will figure it out. The last thing I want to do is just some practical advice for people with back pain. Okay. When they roll over in bed at night, Renata, can you line the back? Okay. It's not a good idea when someone rolls over to do this. That is just rotating the lumbar spine. And if you've ever had back pain, I have, you will know that in the middle of the night is painful. Okay? If you don't want this to move, bend both your knees. Okay. You bring the knees up. You bring the arm over and you move as a unit. That. As simple as that. This saves your back from that wear and tear and trauma. Okay? One other thing, how do you get up off the floor? Okay. So pretend you've got back pain. How would you get up off the floor? Yes? Stay as a unit. Very good. As little movement as possible. It's very simple advice, but people don't do it. They need you as a therapist to say, this is how you move now, because you know that the lumbar spine doesn't like to rotate. Okay? And this can help tremendously. The last thing, getting onto chairs. Alright. Renata, can you take a seat for me? And stand up. Very good. Renata hinges at her hips when she does this. Most people will flex forward. They'll do that. Yeah? And when they get out of the chair, they'll do this. Yes, exactly. So people with back pain, we teach them to keep this straight, hinge at the hips. Can you stand up out of the chair? Beautiful. So there's none of this happening. Flexion. Yeah? Remember, lumbar spines, we flex all the time. Stop flexing. So if you can just do that one more time. Beautiful. And up out the chair. This stays as one unit. Okay. Great.